Hi, good morning, Callus. My name is Mihiraa. Let's start the warm-up session. Describe your typical working day.
My day starts with prayer. After completing my daily routines, I reach my workstation by 7:30. Before taking the handover, I complete my inventories and update the crash cart medication and dressing trolley. After receiving the handover, I interact with my patients to identify their health needs. Based on my assessment plan, a nursing care plan, and provide quality care for my patients. Afterward, I assist the physician in his work and carry out necessary clinical orders. Meanwhile, I find some time to interact with my colleagues and maintain a good rapport with them. My duty ends by 3:30 after I give a handover to the next scheduled staff members.
Which is your favorite destination? Why?
My dream destination is Australia. The first and foremost thing is that Australia has a world-class healthcare system, and I can be a part of it. Secondly, the country has a better standard of living and economic and political stability. Besides, here, nurses are paid well and respected too. In addition, I have many friends and relatives over there, so they can help me during my initial days.
Why did you choose OT?
It is my long-term ambition to work as a registered nurse in any English-speaking country, such as the UK, Ireland, and so on. To meet the requirements to register as a nursing professional there, I need to prove my English language proficiency. Hence, I chose OET to fulfill my dream. Moreover, OET is tailored according to the needs of nursing professionals. Therefore, I believe I could perform well in this test.
What are the current trends in your profession?
Nursing is a dynamic profession, and changes happen daily. Nowadays, technology plays a vital role in my profession. For instance, paper records that we used in the past have been updated to electronic records. Besides, at present, we are following evidence-based practice, which means there is a scientific rationale for every procedure. Moreover, in the present day, a nurse can function as a nurse practitioner, which is equivalent to the position of a physician.
Are you comfortable working with other doctors and nurses?
I find I work well under a variety of conditions and circumstances, and I take pride in my flexibility. I enjoy working in a team because I often find that different viewpoints can help me find solutions to a problem I might not think of on my own. I also enjoy self-motivating and am equally comfortable working alone.
Your preparation time is over. You can now start your role play.
Mihiraa, hi. I'm just finishing up here. Please, have a seat. I can see you've been watching closely, and I know it can be a little unsettling to see your father have blood taken. Thank you for being here with him. Your presence really helps. Now, while he's resting comfortably, I'd like to take a few minutes to walk you through everything, so you both feel fully informed and supported. First of all, let's go over the immediate aftercare for the puncture site. It's really important that we keep the cotton wool and dressing in place for at least 30 to 60 minutes. This gives the tiny puncture hole in the vein a chance to seal over properly. If you notice any slight oozing or a tiny trickle of blood after that time, don't be alarmed. It can happen. Just take a fresh piece of cotton wool, apply firm, steady pressure directly over the site for a minute or two, and that should stop it. Also, for the rest of today, I'd advise him to avoid any heavy lifting or strenuous activity with that arm. Just gentle, normal movements are absolutely fine. After a few hours, he can remove the dressing, and a small plaster is all he needs. Now, with all that in mind, what questions or concerns do you have right now?
That all sounds very manageable, and I'll make sure to keep the dressing on for an hour and watch for any oozing. I do have one question, though. Could you please explain to me why all these blood tests were needed in the first place? I want to understand what you're actually looking for.
That is a wonderful question, Mihiraa, and I completely understand why you would want to know, because it helps to have a clear picture of what we are doing and why. These blood tests serve a few very important purposes, and I would be happy to explain them to you in detail. First and foremost, they help us check your father's general state of health, giving us a broad overview of how his body is functioning overall, which is essential for someone his age. More specifically, the test will look at his liver and kidney function because these are vital organs that process medications and filter waste from the body, and we need to make sure they are working well. We also need to assess the impact of his current medications because sometimes the doses that were appropriate months ago may need adjusting as the body changes, and these tests will show us exactly how his system is responding to them. It is also worth mentioning that these blood tests are part of a more comprehensive routine health check, which includes monitoring things like his blood pressure and even aspects of his cognitive function, all of which work together to give us a complete picture of his well-being. Now, does that help clarify things for you? Or is there anything more you would like me to explain about the tests themselves?
Okay, I understand, but I'm quite worried about this bruising. It's not just me, everyone in the family, including him, is concerned.
Mihiraa, I completely understand your concern, and please know that it is absolutely normal for you and your father to feel this way, because bruising can look quite dramatic and alarming, especially when you are not expecting it. I want to reassure you from the bottom of my heart that this is a very common occurrence, particularly in older adults whose veins tend to be more fragile and delicate, which means the tiny puncture can sometimes allow a small amount of blood to seep out into the surrounding tissue. And that is exactly what a bruise is, just a little pool of blood sitting harmlessly under the skin rather than inside the vein. The important thing to remember is that while it may look quite dark and noticeable, it is not a sign of any harm or that anything went wrong, and it will gradually fade naturally over the next few days, changing color as the body gently reabsorbs it, much like any ordinary bruise. If he experiences any discomfort or slight swelling, I would suggest applying a cool pack wrapped in a soft cloth to the area for about 10 minutes, which can be very soothing. And if he needs it, a simple painkiller like paracetamol can be taken, provided it is safe for him. But if the pain persists or worsens, please do not hesitate to contact the GP for further advice, because his comfort and your peace of mind are both incredibly important to us.
Thank you, Nurse Houston. That really puts my mind at ease. I feel so much better knowing it's normal and will just fade on its own. I'll make sure to use the cool pack if he needs it. So, what happens now with the blood samples? When will we know the results?
I'm so glad that has helped Mihiraa, and that is a very good question to ask next. Now, let me walk you through exactly what happens from here. The blood samples I have collected today will be carefully labeled and sent to the pathology laboratory for a full analysis, where they will be examined by specialist scientists who will look at all the different components, such as his blood cell counts, his kidney and liver function markers, and the levels of various chemicals and medications in his system. This process is quite thorough, so it typically takes about 3 to 5 working days for the laboratory to complete all the necessary tests and for the results to be compiled into a report for the GP. Once the GP has received and reviewed that report, they will contact you to schedule a consultation appointment, where they will go through the findings with you and your father in detail, explain what they mean, and discuss any necessary next steps. Now, with all of that in mind, what concerns or questions do you have about this process? Or is there anything at all that you would like me to clarify further for you?
That sounds very clear, thank you. So we should expect a call from the GP in about 3 to 5 days. Just one more thing. When we do go for that appointment, what exactly will the GP be doing, and is there anything specific I should be prepared for?
That is an excellent question, Mihiraa, and it shows how thoughtful and prepared you are. The GP appointment is actually the most important part of this whole process, because it is the moment where all the laboratory information comes together with your father's clinical picture, allowing the doctor to have a meaningful discussion with you both. During that consultation, the GP will go through each of the test results in detail, explaining what they mean for your father's health, and they will discuss any treatments or adjustments that might be needed, whether that means starting a new medication, changing a dose, or simply continuing with the current plan. And they will also review all of his existing medications to ensure they are still appropriate and working well together. Now, I cannot stress this enough. Mihiraa, I strongly recommend that you attend this appointment with your father because having a family member there makes such a tremendous difference, as it allows for better understanding of complex medical information, gives you the opportunity to ask questions that your father might not think of, and most importantly, helps you both remember the treatment plan and any changes the doctor recommends, because it can be overwhelming to take in everything at once, and your presence provides that extra layer of support and clarity.
Thank you so much, Nurse Houston. I will definitely be there with him, and I feel so much more confident now knowing what to expect. You've been so kind and patient with all my questions, and I really appreciate it.
Mihiraa, you take care of yourself, and please give my very best wishes to Wilfred. Goodbye for now.